Bismillah ar-Rahman ar-Rahim. Today we are going to give a lecture about the antibiotic use. This is from Pharmacy Service Department. We are going to talk about the antibiotic management services and antimicrobial stewardship program. First of all, we are going to approach step by step for the development and implementation of the hospital antibiotic policy and the standards that we are going to use for treatment and the guidelines. First of all, we want to develop an antibiotic policy, and this is, of course, through the hospital antibiotic policy standards and guidelines. We want to do an effective strategy for implementation. Also, we are going to discuss various activities and information required in order to do this. So we have something what we call the antimicrobial resistance, and as we know that serious infectious is going on by certain bacteria and they become resistant through whole years, and they are not only the severe and required longer complex for the medication, but they are also significantly more expensive. So we are working on two ways to we look for the patient safety and we look for the cost of these antibiotics. Antibiotic resistance, initially it's a problem of the hospital setting associated with the increased number of hospital-acquired infections. And as we know that antimicrobial resistance has emerged a major public health problems all over the world, not just only on the hospital or in our hospital. Infectious caused by resistance microbes fail to respond to a certain treatment, resulting in prolonged illness and greater risk of death for those of your patients. So if you are not treating this kind of problems, you are just going to end up with more hospitalized patients and more death rate. Treatment of failures are also lead to longer periods of infectivity with increased numbers of infected people moving to the community. When the patients become resistant to the first-line antibiotics, the excessive high cost of the second-line drugs may result in a failure to treat the disease in many individuals. Most alarming of all are the disease caused by the multi-drug resistant MDR patient. This is what we are afraid of, and this is what we have focused on. The situation on the development of a new antimicrobial agent is not very helpful. Multi-drug resistance nosocomial organism commonly grouped under the abbreviation of ESKAPE. We have availability of new antimicrobial. This is the type of bacteria and the vaccination that we are going to elaborate later on. We want to say that the solution for the current approach of antimicrobial resistance is to preserve the effectiveness of the drugs presently available in the antibiotic stewardship. And this is what we are going to focus about, the effectiveness of implementation of the stewardship program in every and each hospital to decrease the spread of the resistance. This is the step-by-step approach for the development and implementation of the antibiotic hospital policy. We have to develop a system to recognize and to report. We have to develop this system rapidly to detect and report the resistance microorganism also in the individual patients that we have, and to assure increased adherence to the basic infection control policies and procedures. We have to incorporate detection, prevention of control, antimicrobial resistance to the institutional strategic goals. We have to develop a plan of identifying and transferring the discharged patients colonized with a specific antimicrobial resistance. We have to establish a policy and practice for the rational use of antimicrobials. The strategic approaches is to optimize the duration of choice and dose of empirical therapy, optimize the antimicrobial prophylaxis for the operative procedures, and we have to develop and implementing the antibiotic policy and standard treatment guidelines. We have two main strategies: monitoring and providing feedback regarding the antibiotic resistance, improving the antimicrobial prescribing by educational and administrative means. We have to focus on the education, which means that we are going to give a fixed lectures for the awareness of the use of the antibiotics and adhering to stewardship antibiotic program to achieve our comprehensive goals. This is the hospital-associated infections. This is a small scheme about the policy, the standard treatment guideline, the stewardship programs. The antibiotic or antimicrobial is, as we all know, it's a chemical and it's a therapeutic agent that inhibits the growth of the bacteria. The term originally referred to an agent sourced from biological organism. However, antibiotic is now used commonly to refer a substance with antibacterial, antifungal, or anti-parasitical activity. The primary aim of the hospital antimicrobial policy is two things. First one is to minimize the morbidity and mortality due to antimicrobial resistance infection, and to preserve the effectiveness of antimicrobial agent in the treatment and prevention of communicable disease. The antibiotic policy is essentially for the prophylaxis of empirical therapy. The policy shall incorporate specific recommendations for the treatment of different high-risk special groups such as immunocompromised patient, hospital-associated infection, and community-associated infections. The hospital antibiotic policy shall be based on spectrum of antibiotic, pharmacokinetic, pharmacodynamic, adverse effect, potential to select, cost, special needs of individual patients group. It should be also set the level of prescribing antibiotic. For example, first choice of antibiotic can be prescribed by all doctors, while restricted choice antibiotic can be only prescribed after consulting the head of the department or the antimicrobial team one. The key element for the hospital policy is an effective antibiotic policy should be worked on. To develop antibiotic policy, each hospital should establish multidisciplinary antibiotic management team. The team is to develop hospital policy, monitor the patient and implementation, receiving feedback, assessing outcomes, conducting a revision of the policy, and setting audit targets. The group also should develop antibiotic policy from 6 to 10 members. At least one member should have the skills to conduct literature and systemic review. The other infection one assigned to the ATM should include antimicrobial dose, streaming, discontinuation, advice and result of the therapeutic, automatic stop order for the antimicrobial prophylaxis. You have to approve for the restricted antibiotic, assistant in interpretation, indication of use, suggestion of ordering additional laboratory tests. The second one is to review the available of antibiotic policy. The available evidence-based antibiotic policy from other institutes or hospitals may be reviewed. The advantage of adopting from national policy is the clinical decision making and technical skills, as well as the time and financial resources is going to be needed. The policy should be adapted for local needs. This include how information is going to be gathered, cost analysis done, what is the outcome expected. The policy should be also on the systemic review of the scientific evidence, which is minimize the risk of bias. The literature should be identified according to the clear search strategy. In addition to search terms and period of the search should be mentioned. When the strong evidence is not available, a combination of verifying degree of evidence. However, this recommendation should be done with the guarding according to the strength of evidence. The guarding should be also validated based on the study design and quality clinical significance. The policy should be simple, clear, clinically related, flexible, applicable, available in a friendly format. That's why even the ministry has an application now to be easy use for everybody. The characteristic of antibiotic policy is to be the recommended one should be effective against pathogens, and the policy group should identify evidence. For example, an empirical therapy results in clinical failure, then the review of the cumulative antibiogram data may be needed to change the policy.